Hi, I'm Dr. Conn, Neurology and Headache Medicine, and today I'm going to talk about how to choose a vagus nerve stimulator. I'm going to cover 3 devices, and I'm going to talk about which one's my favorite that I use to treat my headaches. So the first device, the first one to come out, is the GammaCore. It comes in this container, and we charge it by plugging it in like this. So this is what the device looks like. We remove the cap and they have the electrodes. So what we do is put conductive jelly on the electrodes, turn it on, put it in the left side of the neck, and start cranking up the stimulation until we feel a movement in this little muscle called the submentalis, and then we stimulate for 3 minutes. So GammaCore is an excellent device. It is FDA approved. It requires a prescription and it costs just under $700 a month, so it's pretty pricey. People can get coverage through their HSA, and veterans have excellent coverage. So the next thing I'm going to discuss are the Two Truvaga devices. Okay, this device is around $300. It's preloaded with about 365 doses, and then this Truvaga device has unlimited stimulation doses, and it costs around $500. Both of them are excellent devices. I personally use the Truvaga to treat this Truvaga Plus that has unlimited doses to treat my migraines. I use it every morning and I stimulate for about 2 minutes. So these are my preferred devices. Other ways to stimulate the vagus nerve are with auricular stimulation hooked on people's ear. I think that's okay, but not as good as these because it only recruits about 2% of the fibers of the vagus nerve, so that's not that much. Other things people will try to stimulate the vagus nerve device-wise is to use their TENS unit, but that's actually unsafe because it can hit the cardiac fibers and cause arrhythmias. Some contraindications to vagus nerve stimulation are pregnancy, a child 12 years old or younger, having metal in one's neck, having a vessel blockage in one's neck, or having had the vagus nerve cut before. People that have had those things occur and those issues really shouldn't stimulate the nerve using devices, but as I've said, there are other ways to stimulate the nerve. In my next video, I'll get into using vagus nerve stimulation for other conditions than migraine.